Hello everyone, this is Dr. Sushma Sarala, consulting homeopath at Fidicus Home. Now let's get into the causes and risk factors for this AUB or the dysfunctional uterine bleeding. As you can see in the picture, the causes can be divided into two types, that is structural causes and non-structural causes. In the structural causes, you can remember if you're a medical aspirant or if you're a doctor and you're like in your second year or first year and you're trying to know different diseases, or if you're suffering from it and you want to remember what sort of pathology is in it, remember that the structural causes can be remembered by a mnemonic PALM. So P stands for polyp, and then A stands for adenomyosis. Polyp is like a tumorous structure. Adenomyosis is the endometrial layer which is getting into the muscle layer of the uterus. Okay, that is called as adenomyosis. And L is called as leiomyoma, which is the other name for fibroid uterus, and also M for malignancy, that is any sort of cancer. These are the structural changes that are occurring in the uterus. What are the non-structural changes? That is coagulopathy. Any sort of coagulation problems can lead in also to abnormal uterine bleeding. Ovulatory, if you have any sort of anovulatory or ovulatory rhythms which are causing this abnormal uterine bleeding. And then we have endometrial. If the endometrial thickness is too much, then that can lead into bulky uterus, leading into abnormal uterine bleeding. Remember that in anovulatory cycles, when there is too much production of the estrogen, that can also trigger too much production or thickness of the, it can increase the thickness of the endometrium. That can also lead into abnormal uterine bleeding. And then iatrogenic. What is iatrogenic? Let's see. Any sort of diseases occurring after the usage of medicines are called as iatrogenic diseases or iatrogenic factors. So why are we discussing? Say, remember that especially in India, many people prefer to prepone or postpone their period for a certain event or for a certain ritual. Okay. So if you're absolutely healthy and after using these hormonal pills to prepone or postpone your menstruation, you have got this AUB, that is abnormal uterine bleeding, and that can be because of iatrogenic factor, that is because of the medicine. And also, if you're using contraceptives from a very young age, or if you're using IUCDs, that is intrauterine contraceptive devices, you can occur or it can cause this abnormal uterine bleeding. You can be absolutely healthy. After using this contraceptive pills or contraceptive devices, there is abnormality occurring, then that is called as iatrogenic occurrence or iatrogenic factors for occurrence of AUB. And also, if you're using any sort of hormonal replacement therapies or if you're using some psychiatric drugs, these also can trigger a lot of abnormal uterine bleeding. If you're suffering from anxiety, panic attacks, certain medications can trigger abnormal bleeding or they can cause prolonged bleeding in certain section of people. So all of these abnormal bleeding problems caused due to drugs or caused due to these hormonal pills are called as iatrogenic diseases. There are other systemic diseases that can cause abnormal bleeding, which is cirrhosis of liver can cause abnormal uterine bleeding, coagulopathy can cause abnormal bleeding, and also, as I told you already, hypothyroidism, mostly than the hypothyroidism, can cause abnormal uterine bleeding. Coagulation disorders, and also, as I already told you, hypothyroidism rather than the hyperthyroidism can lead into abnormal uterine bleeding. If you're watching this video and if you're suffering from abnormal uterine bleeding, so you can consult us through online or offline options, as we are having good success rate in treating these diseases. If you are staying nearby the nearest branch of Fidicus, you can come and contact us in person. If you are staying outside or you cannot reach us in person, you can contact us online either through audio call or through the video call. And also, after doctor consultation, you can share with us any sort of investigations that you've already gone through, and if we need any more, we will let you know. After all this doctor consultation, we will deliver the medicines to you, or the medicines will be sent through courier. If you're staying in India, it can take 3 to 4 business days. If you're staying in USA, it can take 3 to 5 business days, and across the globe, it can take 4 to 8 business days. If you're suffering from abnormal bleeding and you would like to get in touch with us, you can call us through this number. You can WhatsApp us, you can ping us or message us on this number. If you would like to know more about Fidicus Homeopathy, you can check this website www.fidicus.com. If you're suffering from uterine bleeding, if you're suffering from any sort of female complaints and you're looking for cure, why should you choose Fidicus Homeopathy? Remember, Fidicus Homeopathy stands for highest chance of health. Here we follow 3 principles. Primarily, the reason for doing this video is the high amount of success rate we are having in already treating the uterine bleeding, that is abnormal uterine bleeding cases. the transparent treatment here at Fidicus. That is, there is no gray area between the person and the doctor. We will be educating you on the prognosis of the case, the cause of the case, and everything. And also the personal care here at Fidicus. So what is the personal care that we give? If you're sort of having any sort of, dilemmas, myths about this condition of yours, we will educate you on that. So if you want to choose cure, choose Fidicus Homeopathy. Thank you.
Fidicus Homeopathy.